right, we are back with our experts answering your questions. All right, Steve, let's talk about this. I'm retired and I have a company pension plan with PPO medical insurance. Should I be looking at these Medicare plans?
Possibly. So here's the deal with this question. If you have a PPO plan through your work, here's the questions you should be asking. What is my deductibles? What is my copays? And what is my annual out-of-pocket maximum? Okay, you can compare that to our Medicare Advantage plans or a traditional Medicare plan, and you can say, okay, what are those deductibles? What are those out-of-pocket maximums? So you have to compare those. So the answer to the question could be yes or no, depending upon your exact PPO plan that you have and what your deductibles and annual out-of-pocket maximums are. Most of the Medicare Advantage plans nowadays, you can get an annual out-of-pocket maximum a lot of times for $34, $35, $3,600. So a lot of times you're going to be in a better situation to go on Medicare and choose a Medicare Advantage plan.
All right, but that takes some doing, and so folks might need to call either SHIP or AARP or an insurance agent to kind of see if they can figure that out, but that's a good starting point. All right, Laura, this person's asking, is ACA better than North Carolina Medicaid for disabled folks?
Well, first of all, it's very hard to qualify for Medicaid in North Carolina because North Carolina is one of the 11 states that hasn't expanded Medicaid yet to low-income people. They nearly did it in the legislature this year, and they're looking to do it next year. So contact your legislators and tell them to expand Medicaid. But setting that aside, if you are eligible, it is probably a better deal for you because probably an ACA policy would cost more for somebody in your circumstances.
Okay, this person's asking about the deadline time of December 7th for the Medicare enrollment, and they're saying, is it true that the enrollment date has been extended due to the hurricanes?
I can take that. There are extenuating circumstances associated with certain special enrollment periods. One of them is a natural disaster, and that a hurricane would fit in that definition. So they have extended certain special elective circumstances. The best thing to do is to contact SHIP or 1-800-Medicare to find out if they would be eligible for that extenuating circumstance in that special enrollment period. But that is correct.
All right, it may be in some states or the people who were affected, but it's not
Right.
all for everyone.
Yeah, it's limited to a geographic area. That's correct.
Okay, good to know. All right, so Steve, this person is asking, why would I need to have a Medigap plan along with my regular Medicare coverage? Is that necessary?
Well, it's very necessary because when you're looking at your regular Medicare coverage, Part A is decent coverage. You do have a deductible if you go in the hospital, which is going to range you $1,500. But your problem is your Part B is like 80% coverage. So it's 80%. Guess who owes the other 20%? You do. So if you don't have a Medigap policy to fill in that 20% for you, then that 20% is going to come out of your pocket. So you really do need the extra coverage in most cases.
Okay. Laura, this person is asking, and I think it can go for Medicare or it can go for ACA. It says, if you like your coverage and you want to keep the same coverage, do you have to do anything?
You don't usually because you will be auto renewed. However, you should definitely sign on, make sure that you still have the best possible coverage, and at least for the Affordable Care Act, update your income estimates for next year to see what other subsidies you qualify for.
Because they may have a plan that this year their doctor is on it, but next year their doctor is not on it. And it's not like there's going to be a big red flashing sign that says there's changes.
Absolutely.
Okay, so they need to check not just their doctors, but several other things as well. I'm thinking medications.
Your prescription drug coverage, what doctors and facilities are included in the plan, if any levels of what things they cover have changed as well. So it's always worth a few minutes to go back in and check and make sure.
Okay, yes, definitely check and see what those copays, those premiums, all that stuff is. Okay.